Hello, welcome to the last part of this presentation on the anatomy of the thorax. For this last part, we will be talking about the organs comprising the respiratory system. So that would mean the respiratory passages or the uh, conducting airways and the gas exchange mechanism. That would be the lungs. No? Okay, the respiratory tract or the gas conducting organ is actually divided into an upper and a lower respiratory tract. So, by the upper respiratory tract, it would include the nasal passages, the sinus, the pharynx, larynx, up to the upper portions of the trachea. So, the upper portions of the trachea would involve the cervical portions of the trachea. So, that part of the trachea that extends from the suprasternal nuts up to the cricoid cartilage. Okay. And the lower respiratory tract consists of the lower portions of the trachea. So that would mean from the suprasternal nuts up to the sternal angle of Lewy, which is at the same level as the bifurcation of the trachea. So that would consist the lower portions of the trachea. And then the bronchi, the several generations of bronchi. We have your mainstream bronchos, secondary bronchos, tertiary bronchos, and the bronchioles, okay, up to the terminal portion, which is the respiratory bronchioles. Okay. First of all, let's talk about, so for this uh, uh, last part, I will just uh, touch on the lower respiratory tract, no? Because this is the part that is contained within the thoracic cavity. So the trachea, as we know, extends from the lower border of the cricoid cartilage up to the level of the sternal angle of fluid. Is the, as we know, the cricoid cartilage is very palpable. No? It is just immediately below the Adam's apple. Okay. And this is at the level of the six cervical vertebra. Okay. Now the trachea, if you notice, is embedded with uh, a U-shaped bar of hyaline cartilage. This one, okay. The purpose of this U-shaped hyaline cartilage, which forms your tracheal rings, okay. The purpose of this is actually to prevent the trachea, especially the intrathoracic portion of the trachea, from collapsing from the uh, intrathoracic pressure, compression caused by the intrathoracic pressure. And posteriorly, the tracheal cartilage is incomplete, okay? And that gap between the posterior end of the tracheal cartilage is actually bridged by a muscle known as the trachealis muscle. And also the reason why there is a gap in the posterior portion of the trachea is actually to give allowance for the esophagus to expand into the posterior portion of the trachea, especially during swallowing. We must know that the esophagus is located just immediately posterior to the trachea. Okay. Okay. At the level of the sternal angle of Lewy, the trachea bifurcates into the left main bronchus and the right main bronchus. If you notice, there is a difference between the two, no? The left main bronchus, it's much longer. It is has a narrower caliber as compared to the right main bronchus, which is much shorter and much bigger caliber. Another difference is that the left main bronchus bifurcates uh, from the trachea at an acute angle. Okay, so it is more horizontal as compared to the right main bronchus, okay, which is more vertical. And this has clinical significance because um, in cases wherein there is accidental swallowing of objects, especially in children, okay, there is or accidental aspiration of fluid, okay, uh, there is a propensity for this aspirated material to lodge into the right main bronchus rather than on the left main bronchus. Okay. Okay. Going now to the lungs. Okay. The lungs is a soft, spongy, uh, elastic organ occupying the pleural cavity. Okay. Uh, it has several surface and boundaries. Okay. So the parts of the lungs, we have your apex. This is the apex. Okay. This is the anterior border. This is the left lung. This is the right lung. This is anterior border, which has a much sharper margin. And this is the posterior border, which is much broader and more blunt. Okay. This is the basal surface or the diaphragmatic surface. Okay. This is the inferior border, okay, of the lungs. Okay. As to surfaces, the part of the lungs, this one that faces the mediastinum is known as the mediastinal surface. So this is the mediastinal surface, and the part of the lungs that presses against the inner surface of the ribs, this area here, is known as the costal surface. Okay, and this one, the surface that sits on top of the diaphragm, this is also known as the diaphragmatic surface. If you notice, the lungs has lobes as well as fissure. This one, okay. The left lung has only two lobes, which is divided by an oblique fissure. This one, while the right lung, the left lung, or the left lung rather, has only two lobes, while the right lung has three lobes, which are divided by two fissure. You have your oblique fissure and your horizontal fissure. If we look at the mediastinal surface of the left lung, okay, and right lung, okay, the area where the bronchus, the pulmonary artery and vein enters the the lung, the area, this one here, is known as the hilum. Okay, okay. Now, that portion extending from the hilum, okay, up to the bifurcation of the bronchus, okay, that that portion that consists of the bronchus, the pulmonary artery, and pulmonary vein. Okay, this one here, wrapped by uh, a cuff of the parietal pleura. Okay, this is known as the root of the lungs. So the root of the lungs entering into the hilum of the lungs. If you notice, the parietal pleura at the root of the lung, it's much more lax. Okay, okay, and it has a double fold extension inferiorly. This double fold extension of the parietal pleura over the root of the lung is known as the pulmonary ligament. Okay, this is the pulmonary ligament. Okay. And what else can we see in the mediastinal surface of the lungs? Yes, there are some grooves or impressions that we could visualize on the mediastinal surface of the lungs. These are, these are actually imprints of structures in the mediastinal portion of the thoracic cavity. Okay, so in the left lung, you have a depression there. Okay, this depression is known as the cardiac fossa. This is the area that accommodates the left ventricle. Okay, on the right, we have also as the right cardiac fossa, which accommodates the left atrium. Okay, we also have here on the left a groove for the arch of the aorta and the descending thoracic aorta. Okay, we have also on the right the groove for the esophagus. Okay, a groove for the subclavian artery and vein there. Okay, and very peculiar with the left lung is that the lowermost portion of the anterior border of the lung forms a tongue-like projection known as the lingula. Okay, is the lingula. Okay. Okay, these are the impression. Okay, this is the right lung. You have impression for the esophagus, impression for the superior vena cava and brachiocephalic vein. Okay, impression for the azygos vein. Okay, and within the hilum, you have the different arrangement of the bronchus, the pulmonary artery, and the pulmonary vein. Okay. Okay, this is the left lung and the left mediastinal surface. Okay. Okay. What is bronchopulmonary segments? Now, a bronchopulmonary segment is actually a division of the lobe of a lung. Okay. It is the basic anatomic and functional unit of the lung. Okay. And it is pyramidal in shape. This one. It consists of several lung lobules. Okay. And each bronchopulmonary segment is supplied by one segmental bronchus, okay, a single branch of the pulmonary artery, okay, and it is drained by intersegmental vein, which converges to form the pulmonary vein. Okay, so these are the components of the bronchopulmonary segment. Okay, it is supplied by a tertiary bronchus, a segmental artery which accompanies the bronchus, okay, and intersegmental vein, okay. So it is actually a structurally independent unit because even if you resect one bronchopulmonary segment, it will not affect the functions of the other lobes, okay. On the right lung, there are about 10 bronchopulmonary segments, and on the left, there are about 8 to 10 bronchopulmonary segments. Okay, so this is um, the left lung removed from the pleural cavity. Okay, this is the upper lobe, inferior lobe, oblique fissure. This is the costal surface or the surface that faces the inner uh, wall of the thoracic cavity, you can very well see the impression, okay, of the ribs, okay, over the costal surface of the lungs. Okay, this is the apex. This is the over here is the posterior border, anterior border. This is the inferior border. Underneath would be the dome shaped diaphragmatic surface. Okay, this is the right lung. This is the upper lobe, the middle lobe, and the inferior lobe. This is the horizontal fissure and the oblique fissure. Okay. Okay, this is the mediastinal surface of the left and right lung. Okay, this area here, this is the hilum. Okay, the hilum of the um, left lung. Okay, this is the cut end of the left primary bronchus. Okay, this is the left right primary bronchus over here. Okay, okay. Now blood supply. What is the blood supply of the tracheobronchial tree and the uh, uh, pulmonary parenchyma? Well, the trachea actually receives its blood supply. The upper portion of the trachea receives its blood supply from the inferior thyroid artery, okay? And the lower portion of the trachea receives its blood supply from the bronchial arteries, okay? And the pulmonary parenchyma or the lung itself receives oxygenated blood nutrients coming from the bronchial arteries. Okay, there are actually three bronchial arteries. They are direct branches from the anterior surface of the descending thoracic aorta. Okay, now the pulmonary artery, by the way, is not the arterial supply of the tracheobronchial tree and pulmonary parenchyma. The reason for that is that the pulmonary artery is the only artery in the body that carries deoxygenated blood. Okay, so it does not supply the the lungs. Okay, its main purpose is actually to facilitate uh, gas exchange between carbon dioxide and oxygen. Okay, venous drainage of the tracheobronchial tree is via the right and left bronchial veins, okay, which eventually drains into the right bronchial veins drains into the azygos veins, and the left bronchial veins into the hemiazygos veins. This one. Well, the hemiazygos veins and the accessory azygos veins eventually will empty into the azygos vein, and the azygos vein goes up. It curves and empties into the posterior wall of the superior vena cava. And the pulmonary vein, by the way, is not the venous drainage of the tracheobronchial tree, because the pulmonary vein is the only vein that in the body that carries oxygenated blood. Okay. Lymphatic drainage of the lungs starts from intrapulmonary lymph nodes and efferent intrapulmonary blood vessels. They eventually empty limbs, empty the lymphatic fluids into the hilar nodes over here, then into the superior and inferior tracheobronchial nodes. Then it goes up into the paratracheal nodes, okay, eventually into the bronchomediastinal nodes, okay, and into the left and right bronchomediastinal trunks. Okay, left and right bronchomediastinal trunk. So the right bronchomediastinal trunk will empty into the right lymphatic duct and the left bronchomediastinal trunk will empty into the thoracic duct. Okay. Okay, this is about it. So thank you very much for your attention.